Welcome to the Nourish Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Hey, before we get started, I want you to know about an upcoming workshop I'm hosting in November for parents who have very, very picky eaters. It's called Nutrition for the Extremely Picky Eater, and it's happening on November 4th at 9:30 in the morning, Eastern Time. You can learn all the details and register over on thenourishchild.com/extreme picky eating. Hey everyone, welcome to the Nourish Child Podcast. I'm Jill Castle, your host. This is a show about nourishing children inside and out through food, feeding, and being very aware of their child developmental stage. Today, I have a guest on the show that I think you will all enjoy. She's a graduate of Harvard College and Columbia College of Physicians and Surgeons. It's Dr. Kelly Fradin. She's a pediatrician and mother of two from New York City. As a survivor of childhood cancer, she has unique insight into what families go through when adapting to challenges. Her career has focused on advocating for children with chronic medical conditions in the home, clinic, hospital, and school settings. To support families during COVID-19, she wrote Parenting in a Pandemic, which provided calm, realistic, and evidence-based advice. In her next book, Advanced Parenting, expected from Hatchet in 2023, she plans to tackle the best practices parents can incorporate to support their children when things do not go as expected. When she isn't busy managing her family or her private practice, she can be found on Instagram, where she shares pediatric and parenting advice at Advice I Give My Friends. And that's exactly where I found Dr. Fradin and got to know some of her work. Today, we are talking about adverse childhood experiences. And in all transparency, I don't have a lot of knowledge about this, but I do understand that trauma can affect children and their nutrition and their eating and their self-esteem. And that's some of the stuff we're going to dive in today. So Kelly, welcome to the show. It's an honor to have you here.
Thanks so much for having me. And I think it's really a great topic because we all face trauma. I think we think of trauma as big life events that alter the trajectory of your life. And then there's also trauma. Like psychiatrists talk about it as big T and little t. Like you never know when a stressful experience might be interpreted as your child as a trauma. So I think having an understanding of how trauma affects the brain and the body is really essential to optimizing your physical and mental health.
Yeah. So when we talk about adverse childhood experiences, the acronym is ACES, right? ACES as a plural. Are we really talking about traumatic experiences, the big T and the little T's?
Yes. So there's a robust literature, scientific literature, all these things examining ACEs. And so what ACEs are they're when there's a obvious disruption in the home environment. There's a parent who suffers with substance abuse or mental health issues. There's a parent who's incarcerated or passes away. There's instability in the home environment that leads children to have a sort of lack of stability and safety. And not all ACEs can be prevented. If you look, more than half people have at least one adverse childhood experience. And what the scientific literature indicates is it's really the people who have the most. When you have 4 or more of these adverse childhood experiences, you have worse health outcomes. Things you might expect, like more substance abuse or depression yourself, but also things you might not expect, like a higher risk of diabetes and heart disease or even cancer. So pediatricians and primary care doctors are increasingly aware of the need to identify people, children and adults, who have had these risk factors so that you can provide extra support for those that need it. Because, there's a space between having a difficult experience and having a bad outcome, where you can change how you process that event. You can change the resources you use to recover from that event. And that's where we hope to make a difference.
Yeah. So I'm thinking about, there's obvious ones like you mentioned, substance abuse, divorce. Well, I'm thinking of, like, of course I can't help but think of my own sort of experiences as a child, and I'm a mother of 4. And so my brain is wandering around what have been some of potentially the traumatic experiences for my own children. And one of the things that comes to mind for myself was, my parents divorced when I was an older child, but I still felt like I was a child. So I would qualify that as an ACE. I don't know. I'm looking for your feedback on that one. But then I look at my own children, and, over a span of 12 years, we moved 4 different times. And it's a topic that comes up with my kids a lot, in terms of, well, this happened. If we hadn't moved all these times. So is that sort of what we're talking about? I mean, I think also there's a level of perception, perception is real, right? If a child perceives it as traumatic, but maybe the parent doesn't, I don't know. Help me out with that.
Yes, I absolutely think context matters. I don't think, the events are woven into the fabric of our lives. So what one person experiences during a divorce is different than what another person does, even in the setting of a household. Sometimes teenagers might feel more stressed with a relocation than a 4-year-old.
Mm-hmm.
And so I think it's really important that when we talk about this, we don't cultivate guilt on behalf of parents, because having these experiences, these difficult experiences, can lead to good growth too.
Mm-hmm.
Children can develop coping skills that serve them well in life. Children can find meaning in overcoming difficult situations and grow in their self-esteem. So it's not like we as parents have a duty to just snowplow and provide a zero stress life for our child. But I think as parents, what we should focus on is, when our child has the stressful event, making sure they have all the resources that they need to recover, and making sure that we as parents recover from whatever traumatic experiences we might have had as children.
Mm-hmm.
And I think that becomes really relevant when you talk about nutrition, because so many parents were raised with attitudes towards how they were fed that maybe that's not the style that they want to continue with their child. So sometimes, like that, having the space to think critically about what you've been through and what you're bringing to parenting is important too.
Yeah. So that really touches on something that is near and dear to my heart, and that is helping parents sort of recognize how they were raised in terms of food, what their attitudes are about specific foods, but not only that, how they were fed, what that interaction was. And I have met so many parents where the interaction has not been positive around food, that they don't have they have some fond memories. I think everybody has some fond memories, but they also have some traumatic memories that linger with them. And as you said, sort of being able to recognize what those were and make informed decisions around choosing not to raise their children that way in terms of how they interact around food.
Yes, and I think along those lines, it's important to recognize that. So the literature about ACEs is one thing. We can think of those experiences as sort of the big obvious traumas that we can identify and intervene with. But then there's also the concept of this little T trauma, which we see in terms of it's one of the social determinants of health. We know that people who live in communities where they have more violence, or harder commutes, or more noise pollution, or more day-to-day difficulties where they can't control their surroundings, these people carry a bigger allostatic load. And that kind of small stress also adds up and can do things like affect your risk of heart disease or your risk of high blood pressure. And so as families, I have to say, it's very common that I see mealtime start to become like a little T stress, because parents really want to do right by their children, They really want to see their children grow and thrive and enjoy nutritious food. It's very important to them, but often there's resistance and there's difficulties, and sometimes your other caregivers or co-parents aren't on the same page as you, and sometimes you have just day-to-day struggles with feeding your children. And I think sometimes as a pediatrician, I am trying to help families navigate that in a way that optimizes the child's nutrition, but also approaches the reality of, like, I want mealtimes to be a pleasant experience. And I don't want mealtimes to add to your daily burden of stress. Like, I want us to have positive associations with food and eating. I think that day-to-day stuff matters a lot too.
Yeah. In your experience as a pediatrician, is that something that comes up pretty frequently? The stress around meal times and...
Yes, I think when you're able to spend the time to really talk with families, I think a lot of pediatricians probably have short visits with their families and they don't have time to really dig into what mealtime is like. But as a parent myself, I know that that it can be a challenge to get young kids to the table, to keep them behaving appropriately and not throwing food, not getting out, not screaming that they want something different. And it can be easy. I know a lot of parents have really easy meal times and children who aren't so picky, but I think for many families, as they adapt around their other commitments, if they're working or if they're trying to juggle school children with their after school schedules and activities, I think mealtime can be a stressful part of the day.
Yeah. And oftentimes it's the only part of the day where an entire family gets to be together at that one juncture. So it is important that it's a positive environment. You mentioned picky eaters, and one of the groupings of children that I've worked a lot with over the years are children with extreme picky eating. Now we call it ARFID, avoidant restrictive food intake disorder, but not every child has been diagnosed with that. But they're exhibiting, not your typical toddler picky eating, but that sort of like they're older, they're still really resistant. And then I do feel like those children oftentimes do feel trauma around their food choices, their eating patterns, or their lack of eating from the family, but also from peers and from just society as a whole. And I assume, that's probably a little T. Are there other conditions, medical conditions, where you are seeing maybe some stress that could fall under the category of an ACE or a small trauma to children around food and nutrition?
Yes. Well, in addition to, I think picky eating is a really common one because I suspect that the ARFID diagnosis may be kind of underutilized because so often parents try to manage this on their own. And so many parents internalize the stress of this, like, I should be able to figure out how to feed my kids. And part of why I'm always encouraging parents with picky eaters to seek the services of a dietitian or a speech and swallow therapist or really a feeding therapist is because you can offload some of that stress and pressure you're putting on yourself and get a plan that you can follow and get support, and then you can focus your energy on making the mealtime a positive experience and a way you can connect with your family.
Yeah.
And it's not a failure to get those resources on board. So I do often encourage that just for that reason, because also intervening earlier is often really helpful.
Yeah.
But in terms of other diagnoses, I think often when children are on the smaller side, parents, there's a lot of cultures where we really value big, strong, healthy seeming kids, and we equate adequate weight gain and big size health. And it's not always true. There are plenty of very, very healthy tiny kids out there.
Mm-hmm.
And I think sometimes parents put a lot of pressure on themselves. Even kids are the 10th or 20th percentile, they might still feel like I've got to get more calories and more into this kid. And maybe the child is on the path they're supposed to be on. But sometimes we put a lot of pressure on ourselves to fix things that maybe don't even need fixing. Then there's other conditions that are obviously day-to-day stressful, like food allergies, where you have to be vigilant about exposures to different foods that may trigger reactions, or under that umbrella, like FPIEs. And then you might also, people worry about the diet impacting eczema and other conditions. I think there's children with diabetes who obviously people start to again become like hypervigilant about everything they're eating and thinking about. And it's the families that I feel like when the parent and the child are always thinking about the food and the nutrition, that's when I start to worry, because I don't want it to be sort of a chronic stress, or I want there to be some days where it feels easy and you're following a plan and you're in more of a flow state. Because, we know when you're in sort of the fight or flight mode of feeling stress, your cortisol level peaks. It decreases the amount of growth hormone, it impairs your sleep. And when we can get away from that fight or flight mode more into a relaxation state, you have more happy hormones, your digestion improves, your connection with your family is more facilitated. So it's all about switching kind of from that activated hypervigilant state to finding like a little bit more relaxation.
Yeah, I like that. One of the other chronic conditions, and I don't know that it necessarily relates specifically to parents, but it could relate also to society, is children who carry extra body weight or extra body fat, and the stigma and bullying that can come with that for some children. And I have to believe that that's also falls under the category of stress or trauma or an ACE.
Absolutely.
Yeah.
I think it's a difficult topic to address, but there's this need parents have to really like nourish their child and make sure they have enough energy and that they're getting the foods they want and that they enjoy, but at the same time making sure you're facilitating their health. And sometimes that line of like where to draw the line and when to draw the line can be really, really confusing. Mm-hmm. So even for parents and caregivers who have the best intentions, they might find themselves thinking, is this a limit I should set, or is this okay? And it might be difficult for them. And when I'm working with parents and families facing this situation, I find myself really trying to look at the framework the family uses rather than, the things that encourage them to pay more attention and get in that hypervigilant state. So I'm not working with families about portion size, for example. Mm-hmm. I'm working for them about meal planning and menu choices. So I'd like to set it up that the whole family's eating the same meal so that no one's getting told that they can or can't have something that somebody else is having. And I think about the food that comes into the house in terms of like the grocery shopping list, so it's much easier to work with families on making what's available in their home appropriate than restricting one person's behavior. Because we know that not only is restriction stressful, it doesn't necessarily work.
Yeah, no.
And so that's the kind of way that I choose to approach it. And it also helps to kind of stop some of the labeling, like the idea that this is a good food or a treat food, or like, and then, along the same lines, when the children are on the heavy side, often we're talking about ways to schedule in physical activity, not just for that child, but for the whole family. Yeah. Like, are we finding ways to move? Are we setting our schedule up to not be too sedentary in our day-to-day lives, which got a lot harder during the pandemic. A lot of kids,
sure,
with so many activities canceled.
Yeah,
but I do think there are ways to approach healthy eating in a way that takes the load off the day-to-day decisions and puts it more on like the long-term plan.
Yeah.
And also recognizes that those choices, like the endpoint that matters isn't actually the number on the scale or the size clothing. The endpoint that matters is the quality of the food going in and the quality of the movement and activity and how the child feels. And I think by focusing on those things, you can take away some of the day-to-day stress.
Do you worry that your child is more than picky, like a lot more? If you feel like you've tried everything and nothing is working, nothing is getting better, I want you to know there's more to understand. Things like how your child perceives food, who your child is when he is around food, including what motivates him and what demotivates him, who you are when you feed your child, and so much more. All of these things integrate and interact to produce the child you see at the table every night. Let's end all that worry and confusion. Join me for a live 4-hour workshop on November 4th called Nutrition for the Extremely Picky Eater. You can learn the details and register over on thenourishchild.com/extreme picky eating. So when we talk about these adverse childhood events, you mentioned earlier that they really are associated with some long-term health impacts. Can we talk about what those look like, what the research is telling us about those long-term?
Absolutely. So we, the CDC has a really impressive page about the ACEs literature. And I think the ones that are most obvious are the ones, the mental health and substance abuse and risk-taking behavior ones. So we know that that children who have more stress when they grow up. If you grow up in a home where you're abused or you're seeing violence or you're neglected, you're going to be at a higher risk of having problems with substance use disorder or having depression or anxiety, because during a period of sort of critical growth and development of your brain and your emotional reserves, you have gone through this difficult experience. And I think that is intuitive for a lot of people. But it is important to know that it's a real thing, because unfortunately, there's still a lot of stigma about mental health disorders. And sometimes people who might brush their prior traumatic history under the rug, if it's just for mental health, might be a lot more motivated to go to the therapist and dive into healing and recovering from a stressful experience when they know that it's also associated with your physical health. And I think that the data is really strong about your physical health. So whether it's mediated, so the question is, you have this stressful experience, how does that lead to an increased risk of cancer later on? Right? And there might be some confusion about that. And I think it goes back to what I mentioned earlier about activating sort of, they call it the HPA axis, the hypothalamic pituitary axis, which are those stress hormones and the fight or flight impulses. And when those are activated over long periods of time, like years, that can do things like change your insulin resistance and change the levels of inflammation in your body in a way that will increase your risk of cancer. Does it mean that like going through stress means you're going to get cancer? No, these are small effects. Like maybe it'll change your risk by 10%, but the risk maybe was, 1 in 100 adults might get this kind of cancer. Now it's 1.1, but it still matters when you're looking at a big population of people.
Sure.
So I don't want to scare people to think that their stress is their destiny. There's a lot you can do to protect yourself from the effects of those stresses that you've been through and to recover from them. But the impact on health is real. And there are some really impressive numbers about when you've had 4 or 5 or 6 adverse childhood experiences, it really starts to add up.
So I did read a little bit about that, and I read that if you have 6 or more, there was some really shocking percentage of physical ailments down the road. Can you walk us through that? And then not only that, can you kind of give us a case study of what is 6 adverse, stack those up for us and give us sort of the picture of what that could look like?
Yes, I'm just gonna pull up some things so I can tell you about it with more numbers at my hands. So let's see. So so the idea is that if we were able to wave a magic wand and prevent ACEs, if we could just make all the ACEs go away, 2 million people might have less heart disease every year in the US. That's a big number, right?
Mm-hmm.
21 million cases of depression might go away. So there's also kidney disease, stroke, and all these other conditions like asthma. Also, having ACEs exposure increases your risk of being a smoker or being a drinker, or having decreased educational attainment, not getting the same level of education you might have gotten otherwise.
Mm-hmm.
So, I spent a lot of my career working in the South Bronx in a public health capacity, helping families through chronic diseases. And I'll tell you, I'll share an example. Just try to make it kind of anonymous and change a few things.
Yeah.
So I had a mom who was on the younger side, and whose parents one had been incarcerated and one had been a drug user and neglectful. And this mother had been put into foster care later on, and had suffered with depression and substance use herself. And then she grew up, and she had a child who had chronic health conditions. And as she was trying to care for that child, she didn't have a lot of family support, and she didn't have a good job and a lot of money to address to make things easier, to hire more help, or to make things easier for herself. Even getting to and from appointments was a real stress because she didn't have access to a car, and public transportation with a child with a disability is not easy. And she was very distrustful of other people coming into her home because people might abuse her child, right? So it made it very difficult for her to accept help that her family could have really benefited from. So in taking care of her child and helping her child get all the things that her child needed, the best way I could do that was to help the mom recover from what she had been through. Because acknowledging that she has a lot of this distrust, and she had a lot of instability, and she had a lot of risk factors for depression. If she couldn't get to a place where she could be stronger and more capable and resilient of overcoming these things, it would be very difficult for her child long term.
Mm-hmm.
So yes, I could try to patch it together to help her take care of her child by getting more resources for her and more supports, but those would only be incorporated productively if the mom had the mental health support she needed, and the energy, and her own health in a good spot.
Yeah.
So I think it's also an example of how ACEs can be toxic stress is a multi-generational problem, because when someone who is a parent and is dealing with the repercussions of having their own traumatic childhood, they bring that to their parenting, and they bring they may not have had all the positive experiences that many of us have had in terms of examples of how to discipline your children, or how to set limits productively, or how to set a schedule and a structure for your household that will help and they frankly may not have a lot of energy left over to develop those things when they grew up in an environment with less of those kind of positive parenting hallmarks.
Right.
So that's why it's such a hard public health problem to address. But I think the first step is being aware, right? So there's this campaign nationally called Trauma-Informed Schools. And the idea there is that when a child is truant, is absent from school a lot, or when they're failing in school, often the old school way of thinking about it was to like punish the child. And the new school way of thinking about it is to understand that this negative school outcomes, like say the child is misbehaving in school a lot, often they're coming from a place of needing more resources and needing more help. Maybe the child is overcoming a trauma, maybe the parent is overcoming a trauma, but addressing the underlying cause of the school failure is going to help that family so much more long term than detentions or suspensions or repeating a grade. So when we can help schools to have the resources they need, mental health professionals, training, to sort of see families that have been impacted by trauma and help them, it could really set those people up for success in such an important way.
Yeah. They're always, I always feel like when a child is experiencing a problem with nutrition, for example, because that's my area of expertise, I always want to look and understand why that may be. And it's not always just my child's picking the unhealthy foods. A lot of it, there's a lot below the surface oftentimes, and supporting parents to feel good about, in my case, parenting around food, in your case, raising children, and navigating all the ups and downs that go along with that. Helping parents feel really empowered about the job that they're doing is much more valuable to me than giving them a recipe for a better version of mac and cheese, for example. It just has more legs. It's going to last longer and have a longer impact, I think. So we've talked about ACEs, and you've emphasized, helping individuals who have experienced trauma work through those. Can you take us through what that kind of looks like? So for parents out there who are listening, or even for healthcare providers out there who are listening, what do we need to be thinking about if we are listening to the show and we say, oh my gosh, I think there's some, ACEs in my child's life, or I've experienced some trauma in the past. I definitely have not dealt with this. Now what? So take us through the now what.
Yes. Well, I suspect that that it would surprise a lot of your listeners to learn that it's not as complicated as you might think to help someone recover from ACEs. I think identification is really the important step to see that prior stress or trauma is impacting you. Because say your child is going through something traumatic. There have been studies, like really big, hundreds of thousands of children studies, looking at the question of like, what is the predictors of resilience for the child? Like what will make it likely that the child will recover and not have consequences from this trauma? And the studies have shown that having a safe, supportive, and nurturing relationship with at least one adult, ideally three, is the number one predictor of resilience in children. So it's not having access to the best therapist or the best psychiatrist or a parent who has a graduate degree or special training or education. It's about having multiple adults in your life who are consistently there for you, consistently supportive of you, and kind of showing you unconditional love. And so it's something that is achievable for most children. And sometimes it's interesting when you work with families on this topic that every family finds it in different places. There's the neighbor who, has cultivated a garden and likes to have the kids over to look at the garden. There's the auntie who's not really part of the family, but is mom's best friend in college. And, but identifying those people who really are supportive influences in your children's lives, and recognizing the contribution they make, and encouraging it, I think, is the most important thing we can do. So if there are resources in your life, acknowledging them and making space for them to be consistent, I think is helpful. And if there aren't enough of those resources, because we've all been so isolated with the pandemic, and that's why I've been particularly worried about trauma now, because the more isolated we are, the less of those relationships that we allow to develop. So if you feel like your child doesn't have enough safe places to go to, adults, I think you start with the school. The school counselors are excellent resources, and they're nice because often they're accessible to the child, and they're there. They're not an extra drive, an extra appointment away. The pediatrician can be a safe and supportive relationship. You can find a therapist or a mental health provider in your community, anybody that your child can talk to. I think it's also important to acknowledge that as parents, we always try to do everything for our child and be everything for our child, but sometimes having somebody who's not the parent that you can talk to is really valuable. Kids might be embarrassed and not want to tell mom or dad how they're really feeling, but sometimes they'll open up in a different way to a professional or to somebody outside of the home. And sometimes they also open up in unexpected environments. Like I often say, instead of face to face during a serious conversation, sometimes like side by side on a commute. That's sometimes when the children will start telling you things that you might not have expected.
Yeah. I'm thinking about COVID and the pandemic, and yes, the isolation, and, the Pollyanna in me likes to really focus on the fact that families were together more, and there were more opportunities for togetherness and connection and communication. But I know that for many families, that probably was not the case. And you've sort of hinted to being concerned about children, being more isolated during that time and perhaps experiencing more trauma during that time. Has there been any research or studies that you know of that sort of kind of put that equation together and given us some insight on that?
Yes, unfortunately, it does seem, we know that during times of isolation and financial stress, there's more abuse. And we know, there's unfortunately a cycle to child abuse. We know more abuse happens during breaks from school, during holidays, during times of financial recession. And so because of that, we had every reason to suspect that the pandemic would be kind of a perfect storm for increased child abuse. And there has increased child abuse. It hasn't been maybe as bad as we might have feared, but about 10% more abuse than prior to the pandemic. And some people express concern because of the idea that, schools are one of the most likely places where abuse is caught. That, it's a place where children go, and, if the kid's coming in bruised or crying, like somebody that is there to recognize it. And so when schools are closed, and when, particularly in communities where many children didn't ever show up for remote learning, that some of the abuse, it might be an underestimate. So it might be more than the 10% increase. But I know a lot of pediatricians, we've been worried about maltreatment during this time. And again, it's not that we blame the families. It's that we know that poverty, job loss, huge amounts of stress, they just directly relate to the abuse. And so if we can help our communities to stay as strong as possible, that would be the best way to help these families.
Yeah, and stay connected to providers that they've been connected with over the years, hopefully too, and use those outlets and services like WIC and SNAP and school lunch programs that, from a nutrition standpoint, help ease some of that stress and that food insecurity.
Yes, and I also think it's important not to pathologize.
Yeah.
Like the pandemic has, for many families, been a time a time when they have had, especially those families with teenagers. Teenagers are normally not home much. And I know so many parents have been very grateful for the gift of the extra time with their children. And I think that we'll see that many families have used this time to deepen their connections, and that there's a lot of positives that have come from it too.
Yeah.
So I hope that the positives will outweigh the negatives for many of the children.
Me too. Dr. Kelly Fradin, thank you so much for coming on the show and talking about ACEs and helping us understand trauma and stress in children and how it can impact their long-term health, both mental and physical. For listeners who are tuned in, how can they connect with you and get your books, your upcoming book, but most importantly, connect with you and learn more from you?
Yes, thank you so much for having me. I hope that there's been some tangible tips here for your listeners. I'm on Instagram way too much, so you can always find me there at Advice I Give My Friends, and I have a Substack newsletter that I try to send out, also called Advice I Give My Friends. So I'd love it if your listeners would connect with me there. And I'm ready to share this episode with my followers too.
Awesome. I will share all the links in the show notes. And again, I thank you so much for coming on the show. I think absolutely people have got some good tidbits from this. And I encourage everybody to go and check out Advice I Give My Friends.
Thank you.
Take care.
Thanks for listening to the Nourished Child Podcast, where the #1 goal is to help you grow a nourished child inside and out.